Hey, I'm a sports medicine doc, so I see a lot of shoulder and knee pain, and I see some sports injuries, but most people who are coming into my office are midlife and they haven't had any injuries. Something just started hurting. And something that's very commonly seen is middle-aged women, perimenopausal or menopausal women, and shoulder pain. This represents unusually high percentage of the people who I see in my office because of shoulder pain. And one of the issues is menopause and the corresponding loss of estrogen. Estrogen plays an enormous role in the health of many tissues in our body. We know about some of the brain effects. We know about the effects on bone loss and osteoporosis or osteopenia, but the effects on our joints and tendons is really what tends to bring people into our office every single day. Estrogen decline changes the collagen. Estrogen normally plays a role in the integrity or elasticity, how much stretch there is in our tendons. As estrogen levels drop, that collagen can become stiffer, which can reduce the flexibility of the shoulder joint. And that can also make us prone to becoming even stiffer if we throw in some inflammation. Now, menopause is also associated with a rise in pro inflammatory cytokines. Everybody knows what cytokines is because of COVID, interleukin 6, etc. And these contribute to the inflammatory changes inside a shoulder, which can lead to significant pain and ultimately thickening of the ligaments and the capsule around the shoulder, which will contribute to the stiffness. Some of the other metabolic changes associated with menopause can include an increase in insulin resistance. So, insulin resistance is one of the earliest markers for type 2 diabetes. We'll typically have insulin resistance for 10 or 15 years before we start to see a rise in our average blood glucose, which will manifest as an increase in our hemoglobin A1C, which we usually get during our annual visits. And uh, frozen shoulders in particular are very common in people with diabetes or insulin resistance. Now, what's going on in a frozen shoulder? Yeah, it goes through a few different stages, but simply put, the first stage is an inflammatory phase, and the latter is the chronic stage. And so, in the inflammatory stage, you typically see someone extraordinary shoulder pain, pain with moving it upwards, out to the side, or up your back. So, in all directions. That's because the capsule or the lining of the shoulder joint has become inflamed. So, stretching that capsule hurts. And your capsule, though, has not yet thickened. That's a later finding. And this is important. In the latter stages of a frozen shoulder, actually the pain starts to diminish because the inflammation is receding. However, the joint capsule and the ligaments have now thickened. So the loss of motion persists. And it's not painful when you try to hit the extremes of motion, you try to raise your arm up, you just can't do it. You can't get past this point. It seems like the shoulder is blocked, or that there is a heavy block of cement that's binding that shoulder up. The best time to deal with a frozen shoulder is during the acute phases, because this is mostly driven by inflammation, meaning the loss of motion is driven by inflammation and not necessarily a mechanical block because the ligaments and capsule have thickened. How do we do this? We typically start with a corticosteroid injection. Now, I know I typically don't love cortisone injections, but there's a time and place for them, of course. And inside the shoulder joint during the acute phase of a frozen shoulder is a very important time to consider one. Why? Because it knocks out the inflammation in the capsule. And the earlier during the course of a frozen shoulder that someone is, the more effective it is. Then we get you into some physical therapy, and range of motion is typically going to return pretty quickly. Can this occur later in the other shoulder? Sadly, yes. Can it recur in the same shoulder? It can. It's not common, but it can. What do we do for people in chronic stages? So they suffered with pain for a few months. Now they have terrific stiffness. Those people can certainly try physical therapy, and physical therapy alone can work. In patients with diabetes, you're looking at least a 1 to 2 year time course until resolution, and you may never gain back full motion. In people without diabetes, you're also typically looking at a long time course of about a year. And if with physical therapy and your own stretching and strengthening program, you see tiny incremental improvements in motion, then you don't need to do anything else. If, however, you hit a roadblock, you've plateaued, you just can't pass through this, then we start to think about procedures like a manipulation under anesthesia, where we put you to sleep and just move the arm. And then that will release or tear the capsule to allow you to get back your motion. And in some cases, we try an arthroscopy where we put a camera inside the shoulder and we surgically release the ligaments. After either a manipulation or this capsulotomy surgery, you still have a substantial amount of physical therapy left to do, but typically within 6 to 8 months, you are going to experience a dramatic improvement in your range of motion and discomfort. Hope that helps. Bye.